So the next drug is inhaled steroids. These are the representative drugs. Beclometasone, dipropionate, budesonide or pulmicort, budesonide or formoterol or Symbicort. It is a combination drug that includes a steroid and a long-acting bronchodilator drug. The next is fluticasone or Flovent, fluticasone in powder, fluticasone or salmeterol advair, a combination drug that includes a steroid and a long-acting bronchodilator drug. Mometasone or Asmanex, mometasone or formoterol dolera, a combination drug that also includes a long-acting bronchodilator drug. Um, Pharmacokinetics. These drugs are rapidly absorbed from the respiratory tract, but they take from 2 to 3 weeks to reach effective levels, and so patients must be encouraged to take them to reach and then maintain the effective levels. They are metabolized by natural systems, mostly within the liver, and are excreted in urine. The glucocorticoids are known to cross the placenta and to enter breast milk. Therapeutic action and indications. Inhaled steroids are used to decrease the inflammatory response in the airway. In an airway that is swollen and narrowed by inflammation and swelling, this action will increase airflow and facilitate respiration. Inhaling the steroid tends to decrease the numerous systemic effects that are associated with steroid use. When administered into the lungs by inhalation, steroid decrease the effectiveness of the inflammatory cells. This has two effects. First one is decreased swelling associated with inflammation and promotion of beta-adrenergic receptor activity that may promote smooth muscle relaxation and inhibit bronchoconstriction. Contraindications. Inhaled steroids are not for emergency use and not for use during an acute asthma attack or status asthmaticus. They should not be used during pregnancy and lactation. Drug-to-drug interactions. The benefit of combining different classes of drugs for the treatment of asthma has resulted in the development of fixed combination drugs. Advair discus and Advair HFA are combination of fluticasone, a steroid, and salmeterol, a sympathetic agent. They are approved for managing asthma in patients 4 years of age and older. So these are the nursing responsibilities. Assess for possible contraindications or cautions, acute asthmatic attacks and allergy to the drugs, which are contraindications and systemic infections, pregnancy or lactation, which requires cautious use. Perform a physical examination to establish baseline data for assessing the effectiveness of the drug and the occurrence of any adverse effects associated with drug therapy. Assess temperature to monitor for possible infections. Monitor blood pressure, pulse, and auscultation to evaluate cardiovascular response. And lastly, examine the nerves to evaluate for any lesions that might lead to systemic absorption of the drug.
Lung surfactants or pulmonary surfactant functions are lowers at air-liquid interface. It protects patency of small airways and prevents movement of fluid into the alveolus. It also enhances mucus clearance and stimulates lung host defense system. So the representative agents of lung surfactants are beractant or Survanta, calfactant or Infaserv, and poractant or Curaserv. So its pharmacokinetics is these drugs are instilled directly into the trachea and begin to act immediately on instillation. They are metabolized in the lungs by the normal surfactant metabolic pathways. Its indications: prophylactic treatment of infants at high risk for developing respiratory distress syndrome or RDS. So it rescues treatment of infants who have developed RDS. So because lung surfactants are used as emergency drugs in the newborn, there are no contraindications. And in drug-to-drug interaction, a drug interaction between cofactant and other medication is not expected to occur. So the nursing responsibilities that are indicated are: we have to assess for possible contraindications or cautions, screen for the time of birth and exact weight to determine appropriate doses. Because this drug is used as an emergency treatment, there are no contraindications to screen for. We have to perform a physical examination to establish baseline data for assessing the effectiveness of the drug and the occurrence of any adverse effects associated with drug therapy. Assess the skin temperature and color to evaluate perfusion. Monitor respirations, adventitious sounds, endotracheal tube placement and patency, and chest movements to evaluate the effectiveness of the drug and drug delivery. So we also have to evaluate blood pressure, pulse, and arterial pressure to monitor the status of the infant, and evaluate blood gases and oxygen saturation to monitor drug effectiveness. And lastly, we have to assess temperature and complete blood count to monitor for sepsis.
So thank you for listening in our discussion. To sum up, um, there are seven drugs in upper respiratory tract which are antitussive, topical nasal decongestants, oral decongestants, topical nasal steroid decongestants, antihistamines, expectorants, mucolytics, and six drugs acting on the lower respiratory tract, which are the xanthines, sulfatomimetics, anticholinergics, leukotriene receptor antagonists, inhaled steroids, and lung surfactants. Thank you.